On the day of your surgery, please plan to arrive at same-day surgery at your scheduled time. The time you are given will be earlier than your surgery time in order to give the RN team time to prepare you for your surgery. Be sure to bring a coach along with you. It's important to have someone else lend support, ask questions, and be there for you. Ideally, this coach will provide assistance after your surgery and during your recovery period. When you first arrive at CMMC, enter through 60 High Street, proceed down the long corridor into the Memorial Wing, take the elevator up to the second floor, turn right off the elevator, and same-day surgery will be the first left. You'll be asked to change into a warming gown. A pre-op nurse team will complete a full assessment including vital signs and will start an IV. For this initial assessment, your coach will be asked to wait in the waiting room until you are changed and the nurses have finished their assessment. They are more than welcome to join you directly after. Once your surgeon is ready for you in the operating room, you will be transported to the holding room. At this point, your coach will wait for you back in the same-day surgery waiting room. The surgeon will call your coach after completing the surgery. There'll be a wait time of approximately 1 to 2 hours before you're brought back into your room at the Orthopedic Institute. Once you're settled, we'll give your coach a call and have them come to your room.
This is the area where the final preparation and safety checks are conducted prior to heading to your operating room. A major portion of this will be meeting your anesthesia team. The anesthesia team will consist of an anesthesiologist and a certified registered nurse anesthetist. Your anesthesiologist is a physician specially trained in anesthesiology and perioperative care. The anesthesiologist will assess all of your medical information and ask you several questions pertaining to your medical history and current state of health. This is part of the final checklist to ensure that you are optimally prepared for surgery and to help guide us in our final anesthetic plan. This anesthetic plan may be very different from patient to patient. Once that is completed, it may be beneficial for you to receive a regional anesthetic. Frequently referred to as the nerve block, this is a procedure which your anesthesiologist will administer a local anesthetic directly around the nerve or nerves correlating to the surgical site. While this process is not overly painful or uncomfortable, a mild relaxing medication may be given. In some cases, regional anesthesia may be utilized to provide loss of sensation enough to allow surgery. In most instances, blocks help decrease pain during and after your operation. Nerve blocks have the added benefit of decreasing the amount of pain medicine needed during surgery, potentially decreasing the side effects seen with narcotic pain medications, for example, breathing problems, nausea, and vomiting. Once this is completed and a final check of the room and materials have been completed, you will be taken to your operating room.
Once you're in the operating room, you'll be greeted by the rest of your surgical team. You'll be asked to move over to the operating room bed. Your nurse anesthetist will be placing monitors on you while your nurse will be making you comfortable on the bed. You will then be given medication to induce anesthesia. You'll be monitored throughout your surgical procedure. You are in the very best hands at the OICM. Once your procedure is complete, you will then be monitored in the recovery room.
This is a computer animation of a knee replacement. For the animation, all the muscles and other soft tissues have been stripped away so we can just see the bone. You can see that the cartilage on the end of the bone has basically been trimmed off, and this cartilage has been replaced with metal and plastic. Those pieces are cemented in place. Once this is done, our goal is to have the artificial knee have all the function and stability of a normal, well-functioning knee without any pain.
When your surgery is finished, you'll go directly to the recovery room. The recovery room is also called the Post-Anesthesia Care Unit, or PACU. In the recovery room, you will wake up from your anesthesia. You will have a registered nurse caring for you while in recovery. Your nurse will make sure that you are warm, receive appropriate pain medication to help manage any discomfort that you have. When you are awake, warm, comfortable, and your vital signs are stable, you will be transferred to your private room on M2. You'll see that we've made every effort to make your room as home-like and welcoming as possible, including seating for visiting family and friends. We will let your coach know where you will be going.
After your surgery and a rest period, we will help you get up and walk. We will of course assist you so you cannot fall. We'll help you get out of bed, we'll use assistive devices such as a walker, and we'll assess your ability to bear weight. You can expect to do exercises with one or more of our certified physical therapists. Please bring in loose, comfortable gym-type clothes and footwear to use with your therapy sessions during your stay with us. You will learn how to walk with a walker or crutches, and you will learn how to do stairs. Your therapist will have an exercise program for you to continue on your own at the hospital and at home. Talking to knee replacement patients from the OICM reinforces what we already know. Patients who follow their therapy instructions will be back to normal everyday activities and the sports and hobbies they enjoy more quickly than the patients who do not. So plan to be active.